When I head to the internet, I come across a lot of myths when it comes to Viagra. I'll read you a few examples. Low battery mode for your phone is basically like Viagra, where you know it's probably not good for your overall health, but it makes you last a hell of a lot longer. Can Viagra increase the size of one's penis? Not entirely Viagra, because it's not instant effect, but like it allegedly makes you last longer or something. I don't know. If any of those sound like something you would say when it comes to Viagra, then you might want to keep watching, because I'm about to debunk 5 commonly believed Viagra myths. Hey, I'm Adi. I'm the patient care specialist here at Pharmaca, and I'm on a mission to help as many of you as possible. So a like and subscribe will go a long way towards helping me achieve that mission. Now, let's get into the video with myth number 1, which says that Viagra can cause instant erections that last for hours. To debunk this myth, it's important that we understand Viagra is a drug used to treat erectile dysfunction. The active ingredient in Viagra, sildenafil citrate, works by helping to achieve and maintain an erection. Erections happen when the protein cyclic guanosine monophosphate, otherwise known as cGMP, is released, resulting in increased blood flow to the penis. Then, another protein called phosphodiesterase type 5, otherwise known as PDE5, breaks down cGMP and stops the erection. In individuals who suffer from erectile dysfunction, PDE5 works too quickly. Viagra comes in and it inhibits PDE5 from working, so blood flow to the penis can occur freely. Now you can imagine this isn't a quick process. In fact, Viagra takes about 30 to 60 minutes to work. So, to you internet phonies out there, stop lying. PCS Abby is on your case. In this paper that looked at the onset and duration of action of sildenafil for the treatment of erectile dysfunction, it was found that the median time to onset of erections was 27 minutes in a range of 12 to 70 minutes after receiving sildenafil 50 milligrams. The paper also found that 71% of patients experienced onset of erections within 30 minutes of dosing and 82% responded within 45 minutes. That's myth number 1, busted. So bring on myth number 2, which is Viagra can increase sexual desire. Viagra doesn't contain any psychoactive properties, meaning it won't have any noticeable effect on the way you feel, think, or perceive things during sex. Its effects are solely physical, meaning it will help you to get and maintain an erection, but it won't change your emotions. However, you might get a little confidence boost as a result of that increase in bedroom performance. In the study that sought out to find the effect of sildenafil on quality of life, it found that there was a significant association between sildenafil use and improvement in libido and sexual drive by month 6. There was no significant improvement in the quality of life scores examined, but treatment satisfaction and overall contentment increased over time. More studies are needed to confirm whether or not Viagra can be used for that purpose, but one thing is for sure, Viagra can't increase sexual desire, but it can improve your bedroom performance. I got it, the trigger word is bedroom performance. There you go. Anyway, let's carry on busting these myths with myth number 3. Viagra is more effective the more pills you take. Let's start off by stating outright that taking 2 pills isn't going to make your erections twice as hard. In fact, the only thing that's going to double are your chances of experiencing adverse effects. According to the FDA, Viagra is dosed based on effectiveness and toleration. The dose may be increased to a maximum recommended dose of 100 milligrams or decreased to 25 milligrams. If you take a dosage in excess of these, then you are more likely to experience adverse effects such as headaches, dizziness, rashes, and sudden drops in blood pressure. Or you might suffer from a side effect that I don't think you want: priapism, a prolonged erection that lasts for several hours. That sounds very painful to talk about. However, if you do experience an erection that lasts for hours, then I do urge you to go and see a doctor immediately. That's myth number 3. Busted! So let's move on to the next myth, which is Viagra is only for older men. In this research paper that looked at aging-related erectile dysfunction and the potential mechanism to halt or delay its onset, it was found that 40% of men in their 40s will have some form of ED, and this prevalence will increase about 10% per decade. However, ED isn't just experienced by men who are older than 40. In fact, it's often overlooked in men who are younger than 40. This paper set to find out about ED in fit and healthy young men, and it came to the conclusion that ED in younger, even more than in older men, can be considered a harbinger of cardiovascular disease, and it offers the unique opportunity to unearth the presence of cardiovascular risk factors, thus allowing effective and high-quality preventative interventions. For the record, the study defined a young man as someone who is aged below 40. Viagra use in young men is something that has become increasingly common. However, there haven't been many studies related to finding out about the age range of these men, but multiple sources report that it can be down to performance anxiety.
What you're describing seems to me like performance anxiety rather than a physical weak erection.
So that's 4 out of 5 myths. Busted. So let's move on to the final one, which is Viagra is the only cure for ED. Although Viagra is the OG of ED treatments, there are newer kids on the block. There's Cialis, which contains sildenafil, which takes 15 to 60 minutes to take effect and lasts up to 36 hours. There's Levitra, which contains sildenafil, which takes 30 to 60 minutes to take effect and lasts between 4 to 6 hours. This is usually recommended for diabetics. There's Spedra, which contains sildenafil, which takes 15 minutes to take effect and lasts between 4 to 6 hours. This is recommended if you need a fast treatment. And I can hear you asking,
Avi, which one is the best?
well, there is no best. There's only the one recommended to you by a healthcare professional. Speaking of which, if you do need advice, then be sure to check out the link in the description where you can contact one of our pharmacists and find the best treatment for you. This is what 145,000 plus reviews found on Google, Trustpilot and FIFO have to say about us. If you want to learn how to use Viagra safely and effectively, then check out this video right here. I'll catch you there.